Hello, it's Dr. Kevin Connors again, a new look of cancer session 12, talking about my favorite things. Oh, this is a fun one today because this is another one of my favorite things, and that is curcumin. You might have heard of curcumin. It's turmeric. It's the active form of turmeric, the spice turmeric that you could buy in the health food store or buy in your local co-op to put into Indian dishes. You might find it in curry. It is a great thing to use. Buy it, use it, get it in your body any way you can get it in your body. If you have cancer, it is a wonderful tool. So you just look at this chart. It's a wonderful chart. That centerpiece. It helps with people that have an overexpression of oncogenes. So we spoke about oncogenes. Those are genes that promote cancer growth. You've seen HER2. Those are estrogen receptive positive breast cancers and ovarian cancers and uterine cancers. Hormone positive cancers, the reason why they're such a nasty thing to have is because you have all these extra receptors on the cell membrane that increase cell reproduction. Well, it only works if the bad estrogen is attached to those receptors, and uh, curcumin help dislodge those bad estrogens from those receptors. So it's just a fantastic tool for that. It decreases growth factors. It affects the growth factor receptors. So it's going to decrease cell reproduction. It's going to decrease survival factors that cancers have. And it is just a wonderful tool to decrease inflammation. We didn't talk about matrix metalloproteases yet. We're going to get to that in a later presentation, but it helps with uh, with that process and just so many positive benefits of curcumin. We could go on and on. On the right on this slide, I love it because this talks about how different drugs target different things, like the COX-2 pathway is the pain pathway. The HER2 pathway is the estrogen receptor pathway, and they have a drug, Herceptin, that is supposed to work so well for that. Well, Herceptin has a bunch of different side effects to it, and in real life it actually works much poorer than it does in any of their studies because they handpicked those studies and used only the ones to get the drug passed that showed positive results, and they just ignored the ones that didn't. Truth, sorry. And like Avastin is supposed to block VEGF production. VEGF production, remember, is the vascular endothelial growth factor where cancer starts to stimulate this endothelial growth factor, so it'll stimulate growth of vascular tissue into its mass so it can get a blood supply and get a glucose supply so it can continue to grow, because how can cancer continue to grow if it doesn't have the ability to get its nutrients? So cancer feeds on glucose, and where is it going to get its glucose? Well, it gets its glucose from your blood supply. So if it can stimulate and increase blood supply into itself, it's going to be able to get glucose and, and and increase its reproduction. Well, Avastin is a drug created that was meant to stop VEGF production. It doesn't do it as well. Again, curcumin does this. Curcumin attacks all these things. It's so multi-targeted. On the left-hand side, it decreases inflammatory cytokines. It decreases enzymes that increase cancer growth and could cause cancers in themselves, because the certain enzymes can affect the DNA telomeres. It it affects growth factors. So growth factors that increase the cell reproduction, curcumin affects those in a positive way. It downregulates receptors that are receptors for increased multiplication, and it up regulates receptors that stimulate apoptosis. I mean, it's like a miracle drug. It's absolutely a miracle drug. It affects adhesion molecules. Remember we talked about galectin-3 was one of those adhesion molecules that causes the cancer cells to kind of bind together. So they bind together and they can kind of team up. So if there's multiple cancer cells bound together, they have a better ability to ward off a response with the macrophage because it's getting too big for the macrophage to surround and kill. Well, curcumin breaks that bondage of those adhesion molecules. So it breaks up the cancer so the immune system can get in between the cells and start to destroy the cancer. It is just, it's a wonderful, wonderful drug, if we want to call it a drug, because it really acts so wonderful, we could call it that. Now, there's some issues on how we want to take this, so we'll talk about that in a second. So it has been shown to affect literally every type of cancer in a positive way. There just isn't anything bad about curcumin. The studies are coming in. A lot of studies on curcumin are coming in. So there's nothing bad about curcumin except what I'm going to tell you. So the only thing bad about curcumin is that if you spill it on you, it will stain your clothes and you will not get it out no matter what you do. So that's the only thing bad about curcumin. Well, who cares? You're swallowing the stuff. Well, that's not always true. So with skin cancers and rashes and things like that, we make our own specific curcumin creams that we want people to put on their body, and then it gets a little difficult because you have to put a band-aid over it or something over to cover it up because it'll stain everything, your sheets and everything. Um, However, that's the only thing bad about curcumin. It has no side effects whatsoever. It is insane not to be taking that if you have cancer or any sort of inflammation processes. It's not a Th1 stimulator. It's not a Th2 stimulator. So if you have an autoimmune disease, curcumin is always safe. So here's some little caveats about taking curcumin. Oh, I was going to put a slide into the curcumin we use. We use a Designs for Health. It's called C3 curcumin. I didn't put that in on this. You can find it in our store. And the reason why I like it is it's pre-emulsified in a fat. So that's rule number one in taking curcumin. Boy, I failed on this slide presentation. I didn't even put in my rules. Rule number one in taking curcumin is you got to take it with a fat. So you have to take it with a fat. So if you take curcumin, if you go down to your natural food store where you buy all your great organic vegetables, you can buy a bag of turmeric. So you can take turmeric, and a percentage of that turmeric is going to be curcumin. So how much of that turmeric should you take on a daily basis? Well, you should probably take up to several teaspoons a day of that turmeric. It would be a great dosage to start on your turmeric. However, it tastes horrible. So unless you're from India and you've developed the taste for that kind of stuff, most Americans don't think turmeric tastes very good. So you're going to want to capsulize it. So it gets really messy if you're going to capsulize it yourself. Your skin turns yellow and all sorts of stuff because it's that yellow curry spice is what it is. So if you buy it in capsules, you want to take a fairly high dose. Most turmeric capsules come in a dosage of 400 to 500 milligrams on the average. So you want to take upwards to 2,000 to 8,000 milligrams of turmeric. Depending on if you have a specific type of cancers, you may even want to take higher doses of that. But you have to take it with a fat. So if you take it with a capsule and it's not pre-emulsified in a fat like Designs for Health product is, then you can take it with a little bit of coconut oil. So it's really simple. Take 3 capsules, take a teaspoon or a tablespoon of coconut oil, and you're good to go. A lot of the studies that came out on turmeric a number of years ago showed that it worked in real life when people were getting it in their food, but it didn't work nearly as well when people were taking capsules, until they figured out it was the delivery system. It needs fat to get across the gut wall. So you just don't absorb it well without a fat. So you want to add a fat to your diet. Now you can certainly take the capsules right with your meal. If you're going to eat a meal that contains a decent amount of fat, you're fine to do it that way too. So I have a lot of patients that do that. The other thing that helps the absorption and helps the half-life of turmeric in your body, and also does so with resveratrol in your body, side note, is taking a little black pepper with it. So black pepper, the constitute of black pepper, works really well to help increase the half-life of turmeric and resveratrol and green tea extract, actually, and it helps the absorption of it. So you got to take it with the fat and a little bit of black pepper, and you're going to be good to go. Very anti-inflammatory. If you have joint issues, autoimmune issues with inflammatory joints, painful joints, Lyme patients, chronic Lyme patients do really well on high dose turmeric, as well as autoimmune patients and anti-cancer patients. It's a wonderful pain reliever too because it blocks COX-2 pathways, and it partly relieves the pain because it blocks the inflammation pathways. So as a decrease in inflammation, that's where most of your pain comes from. So turmeric is a great product. I love it. We use it all the time with patients. All right, we'll get on to the next one next week. I hope you enjoyed it. Bye-bye.